Dave, tell me again, what brought you into the ER?
How many times do I have to say this? My pee hole got glued shut and a tiny champagne bottle got stuck up me bum.
Dave, my poor baby.
Right, but how did this happen?
Well, I was bored last night and I invited Dave over for some drinks and some playtime. And ever since the wedding, he's been really stressed out.
Oh, you two are married.
Is that any of your concern?
My apologies. Please continue.
And I know Dave really wanted to get away from his wife.
You're married to a woman.
Can you please just let him finish?
My apologies. Please.
And my boyfriend, Ricky, he was also out of town.
Oh, you have a boyfriend.
Do you want to hear the story or not?
I mean, more than anything.
So we start hooking up and it's all hot and then we hear this noise downstairs.
No way.
Yeah, and it's Ricky. He like forgot something.
And then what happened?
And then he sees us, he sees the drinks, the crafts, and us butt naked, and he flips out, and then he tackles Dave right to the ground.
And that's when you glued your pee hole shut?
And stuck a champagne bottle up me bum.
I see.
But listen, man, please don't let my wife find out about this.
Oh, well, here's the thing. She was your emergency contact.
Oh no.
What the? This day can't get any better.
Hey, I'm looking for Dave.
Ricky!
Ricky? Oh no!
Never mind. It just did.
You're a dead man. Why isn't she waking up?
Sir, we need you to calm down and tell us exactly what happened.
Pinpoint pupils. She took something.
I brought Narcan.
I don't think this guy's gonna talk. We should just get him out.
She OD'd, man.
Okay, that's good to know. What did she take?
I don't know, man.
Vitals are stable. Oh, she's peeing herself. Let's get her into a gown.
Yep.
Oh!
Was that ice?
Where did that come from?
Why is she dispensing ice from her crotch?
Sir, do you know anything about this?
Yeah, I tried putting ice into her, but it didn't work, man.
Didn't work? What were you trying to do?
You don't know? What kind of nurse are you?
Sir, I've been a nurse for 7 years now, and never have I ever had to shove ice into a patient's crotch before.
Was I supposed to shove it somewhere else?
Can I kick this guy out now?
Sir, why did you put ice in your wife's crotch?
I was trying to get her cold to shock her awake.
Well, you definitely shocked me and the rest of the medical field.
Sir, you can't just shock someone awake by inserting ice into their crotch.
I told you it will work.
She's waking up from the Narcan. Oh my goodness, I peed myself.
Don't worry, Mrs. Pearson. Dr. Pearson over here was able to use his medical expertise to potentially cause cold burns, irritation, small tears, or even introduce bacteria inside your crotch.
Leroy! They told you not to do this the last time. Okay, guys, Mr. Peterson, from now on, do not shove ice into your wife's crotch, or anything else for that matter. No, I'm just gonna grab him out.
Excuse me, sir. You can't go back there.
Sure I can. I'm the Grinch, and I'm here to steal Christmas.
Yeah, I know, but unless you have some sort of medical issue, I can't let you back there.
Well, I mean, I have been having some chest pains lately.
Great! Come fill out these forms. We'll get you checked out.
Oh, okay, thanks. Oh, this is ridiculous. Excuse me, how much longer do I have to wait here?
We will call your name when we're ready, sir.
But it's almost Christmas, and I have 3 more neighborhoods to steal from, including Whoville.
Grunch? Is there a Mr. Grunch here?
Grinch! It's Grinch! Seriously, how do you people not know me yet?
Yes, Mr. Grinch. Please come this way.
Come to me.
So we got your test back, and it seems like the chest pain that you're suffering from is due to high blood pressure.
Well, that makes total sense. Work has been really stressing me out lately.
Well, you're gonna have to take some time off until that pain goes away.
So no stealing Christmas?
No, sir. Doctor's orders.
But what about the Hoo-Hash?
Definitely no stealing the Hoo-Hash.
No stealing the Hoo-Hash? But what will I do with myself?
Just relax and enjoy the holidays. Here. This'll help you get started.
For me? Thank you.
Oh my god! Doctor!
What happened?
It seems as if his heart just grew 3 sizes. I can't believe it.
Oh my god, it's a Christmas miracle.
This really is the best time of the year. God bless everyone.
Jesus, what's going on in there? Heroin Hank's dressed up as the Grinch again. Guess no one told the new girl. God, I hate working the holidays. Got here as fast as I could. Where's the emergency?
The baby's crying. Again.
Okay. And what would you like me to do about that? Make it stop? The sound's getting pretty annoying. Okay, so that's a baby? Crying is kind of his whole thing.
Well, his thing is giving me a migraine.
Yeah, can't you work your magic or, whatever?
That's what you do, right?
Not exactly.
Thanks, you're a lifesaver.
Also, diaper's full. Of course it is. Anything else I can do for you guys while I'm here? Maybe file your taxes?
Oh no, we did that already. We're responsible.
Right. Just not with your baby. Oh no, we're great with kids. Just, not this part. You mean the parenting part?
Exactly. Ugh. It's the crying, the feeding, the holding,
The sleeping, the waking up, the diapers.
the whining, the burping, the spitting.
So, the baby. Pretty much.
But he'll grow out of it. At least that's what happened to our other ones.
I'm sorry, your other ones? What, you thought this was our first kid? No, this one's our third.
We're pretty much pros at this point.
Uh-huh. Where exactly are your other 2 kids right now? Oh, they're right over... Well, they're just here somewhere. Fantastic. 2 missing kids, 1 dirty diaper.
Hey, while you're holding him, can you make sure he's eaten? I think he might be hungry.
Huh, yeah, sure. Why don't I just breastfeed him for you while I'm here?
That'd be great. You're the best.
Blink twice if you want me to call Child Protective Services.
Where is the OB? She just DM'd me. She's stuck in traffic. Okay, Miss Garcia, you need to push. Push!
Betty, you can't just say that to Miss Garcia. She doesn't speak English.
Oh my god. Miss Garcia, I am so sorry. I am so lo siento.
Wow, you're like fluent.
I am. She had a 4-day Duolingo streak last month. Yes, she did.
We need someone who speaks Spanish.
Okay, wait. When I was in Cancun, I was trying to open this door, and this really nice man said puta to me, because it was a push door.
Puta. Okay, that sounds like push.
It does.
Miss Garcia.
Puta. Puta, Miss Garcia. Puta. 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 Puta.
Breaking news. Maria Garcia, a new mother, is suing the hospital where she gave birth for racial discrimination after repeatedly being called in Spanish. The 2 nurses have been placed on temporary leave as the hospital investigates the situation. What brought you into the ER today, ma'am?
You have to help me. I think I might have cancer.
Oh, why do you think you have cancer?
I found something growing on my butt.
All right, let's take a look. Oh my god, is that
Cancer?
chocolate?
Chocolate?
Oh, ma'am, it's a milk dud. You just sat on candy.
That's it? That's my cancer?
Yes, you're gonna be fine, but just check the floors next time. Or the couch.
It was at a Love Island meet and greet.
Right, well make sure you check the meet and greet chairs before you take a seat then.
Got it.
Oh, did you hear the news?
What news?
Janice wasn't a real nurse.
What? That can't be true. She's worked here for months.
Well, there were signs.
Hey, have you ever given this med before? Metronolol? Metamanol?
Metoprolol?
Yes, that's the one. How fast do I give this?
Not fast at all. Over at least 2 minutes.
Oh, awesome, thanks. 2 minutes.
Maybe she never used it before. Different places use different drugs.
Well, what about?
Hey, stupid question.
There is no such thing. What's up?
What meds can I push through that arterial line again?
Never mind. That is a stupid question. The answer is none. Let's go check on your patient.
Oh, right, okay.
Okay, that's a little worse, but I still think our hospital would do its due diligence to make sure all our staff are properly credentialed.
Oh wow, there's already news on her. I didn't know Janice was from Florida.
Florida? Oh yeah, she's a fake.
This morning, a Florida woman is behind bars, accused of treating thousands of hospital patients without a license to do so. Police say 29-year-old Autumn Bardiza, seen here on body cam, was arrested in Palm Coast, Florida for posing as a licensed nurse for nearly 2 years. During that time, providing care to almost 4,500 patients.
We're gonna get a urine sample using a catheter, and since this is a teaching hospital, we'll have our med student do it.
Okay.
Hey doctor, quick question. Which hole should I be aiming for?
Oh, that's funny.
I'm just joking. I know it's the front one. Unless it's the back. The side, maybe?
You don't know which hole the catheter goes in?
Remember, ma'am, this is a teaching hospital. The students are here to learn.
I would just hope after a year of med school, he would know.
Oh, this is my 3rd year, actually.
And they didn't get to the bottom half of the body yet?
There are no stupid questions in a teaching hospital.
I'm no doctor, but which hole feels like a stupid question.
Ma'am, please relax. The catheter will go in easier that way. That is correct. And the hole in which it is inserted is not the butt. Correct. Or the face. Also correct. But the general pubic area.
Excuse me, but I prefer a doctor who doesn't need to play 20 questions to find my urethra.
Urethra! Wow! I'm so glad you knew which hole. I was worried I'd have to look it up.
And in the last room, we have Mr. Smith. 25-year-old male, came in last night for DKA.
How high was his blood sugar?
1,000.
Oh my god. Did you do the DKA protocol?
More like DK Slay protocol.
What was his latest blood sugar?
172.
That's great.
Yes! And now we're checking it every 2 hours.
Standing order?
Of course, Queen.
Betty, I've asked you not to call me that.
The only thing that's a little sus is that ever since he got here, he hasn't sat down.
Really?
For realsies.
Alright, well, let's go say hi to Mr. Smith.
And assess.
Mr. Smith, how are you feeling? I'm doing okay. Would you like to sit down? No! Is there a reason why? I'm trying to get my blood sugar to go down. Okay. I'm not following. If I stay standing, all the sugar in my blood will rush to my feet, and when you check it again, it should be normal.
Well, that's not how blood sugar works.
But I heard you guys say you had to check my sugar every 2 hours. That's correct. And you said it has to be a standing order, so don't I have to be standing when you take it? Sir, a standing order just means we don't have to get the doctor's approval every time we want to do it.
But also, that interpretation kinda eats. Is that why diabetics lose their feet first?
Mr. Smith, you don't have to keep standing. No, I want to stay standing. Fine, suit yourself. I'll be back in 2 hours to check your sugar.
And if you're hypo on us, we will give you a Snickers bar. What? You're not you when you're hungry. Keep up.
Betty, please go home. So you tested positive for an STI. We're gonna send you home with some antibiotics. Yeah, about that. Oh, quick question. Can you give me a little extra? It's standard to just take 1 round of antibiotics for chlamydia, sir. Oh, it's not for me. It's for my girlfriend. Oh, sir, if you've been sexually active with her, she should come get tested too. The thing is, I don't want her to know she has it. Why? Because then she'll know I gave it to her, and then she'll know I got it from someone else. Well, I think that's a conversation you're gonna have to have with her. Can I just pay double? What? No, sir! How are you gonna give her antibiotics without her knowing it's antibiotics? I don't know, I'll tell her it's a new vitamin or something. Absolutely not! Then I'll crush it up and put it in her breakfast cereal. Whatever, man, come on, just help me out. Sir, what you are describing is illegal. You're such a jerk, man. My wife is at home slaving away with our newborn baby, and you would rather add more stress onto her plate than just let me drug her without consent? I'm the jerk in this scenario? Fine. Just go splitsies with my wife with what I get. And you know what? I'll save a pill for the little guy, in case he catches it breastfeeding or something. Once again, not only is that illegal, but it won't cure you if you don't take the full course. And when she finds out, which she will, she's gonna kill you.
She's not gonna find out.
Sir, she just had your baby. She's running on no sleep, pure hormones, and spite. She's gonna be mad at you regardless. But if you lie and try to drug her, she's definitely gonna kill you.
Ugh, fine. I'll tell her when I get home.
And who knows? Maybe she'll forgive me. And we can start a family with a clean slate. Yeah, you never know until you try. Hello, sir. My name is Ben. Oh my god! You were right. She was mad. Oh. Did you hear the news?
What news?
Janice wasn't a real nurse.
What? That can't be true. She's worked here for months.
Well, I mean, there were signs.
Hey, have you ever given this med before? Metronolol? Metamanol?
Metoprolol?
Yes, that's the one. How fast do I give this?
Not fast at all. Over at least 2 minutes.
Oh, awesome, thanks. 2 minutes.
Maybe she never used it before. Different places use different drugs.
Well, what about?
Hey, stupid question.
There is no such thing. What's up?
What meds can I push through that arterial line again?
Never mind. That is a stupid question. The answer is none. Let's go check on your patient.
Oh, right, okay.
Okay, that's a little worse, but I still think our hospital would do its due diligence to make sure all our staff are properly credentialed.
Oh wow, there's already news on her. I didn't know Janice was from Florida.
Florida? Oh yeah, she's a fake.
This morning, a Florida woman is behind bars, accused of treating thousands of hospital patients without a license to do so. Police say 29-year-old Autumn Bardiza, seen here on body cam, was arrested in Palm Coast, Florida for posing as a licensed nurse for nearly 2 years. During that time, providing care to almost 4,500 patients.
Hey, how much longer is this gonna be?
Unfortunately, sir, the wait time is still a little hard to predict.
So you still don't know?
I still don't know.
You see this? Yes, that's your urine sample.
Yeah. What? Why would you do that?
Why not if you're just gonna make me wait here and not use it?
Sir, we need that sample for a test. Without it, all this waiting was for nothing.
What? I guess I didn't think that through.
I can see that.
I guess I should go drink some more fluids then, huh?
Well,
Why don't you just point me to the direction of the cafeteria?
that way.
Thank you.
That was weird, huh?
Oh no, that's just Mr. Jenkins. He does that all the time.
Huh. Sir, you need to poop. It's been almost 3 days.
You think I don't know that? I've tried everything. Laxatives, prunes, reading, walking, calling my mom.
Your mom?
I was desperate. It didn't work.
Well, we've got to figure out something.
Maybe it'll help if you stay in the room while I try to go.
Or maybe just call your mom again. Okay, I'm just gonna give you some privacy.
Wait, stay. I think you being here is helping.
Really? Because it's hurting me.
Seriously, it's working. The closer you get, the closer I get. It's almost there. I can feel it. Oh no.
What?
I think it's stuck. Quick, hold my hand. It'll help me go.
What? Ew, no. What do I look like, a human laxative?
Come on, man, hold it. Stop being such a bad nurse.
No, hold your own hand.
Ugh, fine. I don't need you. I'll do it myself.
No, what are you doing?
What does that look like? I'm getting myself unstuck. Just gotta get it at the right angle. Ah! Oh! Oh! Wow!
Wow.
I feel so much better.
That makes one of us.
Excuse me?
Yes? Aren't you gonna help me wash my hands? No, something tells me you could do that yourself too. Man, the service here is shit.
You gotta help me. I'm withdrawing real bad. I'm sweating, I'm nauseous, I'm seeing things, and look, I'm shaking.
I see in your chart that you drink regularly. When's the last time you had alcohol?
About a day ago. I'm trying to kick that nasty habit.
Well, according to your assessment, your CWA score is between 16 and 20, which could indicate that you're in moderate alcohol withdrawal. Per our protocol, I'll get you some Librium pills.
Librium? Pills?
It's usually our first line of treatment.
I think I might be having a seizure. I think I need Ativan.
You know, tonic-clonic seizures are always accompanied by a loss of consciousness.
I think I'm losing consciousness. Better get that Ativan.
Aha. Can you get into bed for me first? Wouldn't want you to get hurt. I'll be right back.
I think the seizure's getting worse. Is that Ativan?
No, unfortunately, the doctor says if you're having a seizure, she's worried about respiratory arrest, so we're gonna intubate you.
Intubate?
Stick this tube down your throat.
And then Ativan?
Yeah, well, if shoving this tube down your throat doesn't work, then maybe, but probably not.
Whoa. Wow. Did I just have a seizure?
You tell me. How are you feeling?
Much better. Wow, those withdrawals are real bad.
Yeah, it's almost like you never had any symptoms at all.
It's a miracle.
Sure is.
So just to be clear, I'm not getting Ativan?
Definitely not.
Well, is that the time? I really gotta
Go? I figured. I brought the AMA paperwork so you could sign yourself out. You know, if you're really serious about quitting alcohol, I could give you some rehab info.
Rehab? They never have the good stuff. I mean, no thanks.
I'm coming!
I'm coming.
I'm coming! I'm coming?
To you live for a comedy show.
Let's all come together to commiserate and talk some shit about those fucked up hospital conditions you work in. EMS, we're talking to you too!
Healthcare workers show up every day having to work for a company with the resources of a fourth world country.
And still, they do it with honor, with grace.
And with a resting bitch face.
But
they get the job done.
And they deserve more than that measly crumb of a salary you dare to call a fair wage. These conditions are so bad, people would rather quit healthcare and start an OnlyFans.
Because if you're gonna get fucked,
you might as well get paid correctly for it. More cities to be added soon. Ticket link in bio. See you soon, motherfuckers. Has anybody heard from the resident on call? Nope, nada. Not I.
Hello?
Hello, is this the resident on call?
Yes?
I put 2 calls out to you already.
I'm sorry.
We have a patient here with a blood pressure of 170/89.
Oh no.
Yeah, earlier it was in the 150s.
Oh no.
Is everything okay?
Yes, everything's fine.
Does the patient have...
No headache, chest pain, dizziness, confusion. Patient is asymptomatic.
Let's get them on metoprolol with a stat dose now.
Okay. How much? Doctor?
5 milligrams. Let's start with 5 milligrams now.
Okay, look. The lowest dose of metoprolol we usually give is 12.5 milligrams.
Shit. God, so stupid.
Is this your first shift?
Yeah, it's my first solo shift.
Oh, okay. I see. Alright, look, I'm not a doctor, but if I were, I'd consider metoprolol, 12.5 milligrams, twice a day, first dose now.
Okay, sounds good.
What does?
Metoprolol, 12.5 milligrams, twice a day, first dose now.
Is that in order?
Yes.
Great. Thank you, doctor. Do you need me to tell you how to enter it?
Yes, please.
Okay, first thing, turn on your computer.
Are you a healthcare worker? Yes. What do you do? You're an EMT. Fuck yeah. Oh my god. Somebody buy him a drink, he can't afford it. I used to be an EMT too, man. Which, you drive the ambulance? You do everything. Okay, how long have you been an EMT? Couple months? Bitch, you don't do nothing. How dare you? Couple months, I do everything. I'm the best. I deserve a drink now. What you done with? Hi, Mom. Okay, relax. She's like, not me, I'm a nurse. What type of nurse?
Private duty home care.
Private duty home care. Oh, so you got the rich people. You, huh? How many clients do you have? 3 clients. Fuck it, that's it. That's all you need for the week, huh? God damn, what are we doing wrong? She's only gotta wash 3 buttholes a week, which is good. That's great. How long you been a nurse? 29 years. Wow. 29 years. Congrats. Wow. Long time. Fuck yeah, you were there when paper charting was still a thing. I love it. Are you proud of your son's decision to go into the medical career?
Yeah.
That didn't sound convincing at all, right? The yeah, the inflection was bad enough, but the head tilt was just, yeah. You are.
Yeah. He did phlebotomy for a while.
Phlebotomy.
I'm much happier doing it.
You're much happier as an EMT than a phlebotomist.
Yes. Actually, before I
6 months, relax. You'll get there. Give it time, you'll get there. Wait till you walk into a house that you never wanted to walk into, and they just come flying at you, like, hey!
Always naked, I don't know why.
They're always naked, yes. Yes, is that why you went into EMT? Are you a healthcare worker?
Yes.
What do you do?
I'm an EMT.
You're an EMT. Fuck yeah. Oh my god. Somebody buy him a drink, he can't afford it. I used to be an EMT too, man. Which, you drive the ambulance?
I do everything.
You do everything. Okay, how long have you been an EMT? Couple months? Bitch, you don't do nothing. How dare you? Couple months, I do everything. I'm the best. I deserve a drink now. What you done with? Hi, Mom. Okay, relax. She's like, not me, I'm a nurse. What type of nurse?
Private duty home care.
Private duty home care. Oh, so you got the rich people. You, huh? How many clients do you have? 3 clients. Fuck it, that's it. That's all you need for the week, huh? God damn, what are we doing wrong? She's only gotta wash 3 buttholes a week, which is good. That's great. How long you been a nurse? 29 years. Wow. 29 years. Congrats. Wow. Long time. Fuck yeah, you were there when paper charting was still a thing. I love it. Are you proud of your son's decision to go into the medical career?
Yeah.
That didn't sound convincing at all, right? The yeah, the inflection was bad enough, but the head tilt was just, yeah. You are.
Yeah. He did phlebotomy for a while.
Phlebotomy.
I'm much happier doing it.
You're much happier as an EMT than a phlebotomist.
Yes. Actually, before I
6 months, relax. in time. You'll get there. Wait till you walk into a house that you never wanted to walk into, and they just come flying at you and like, hey!
Always naked, I don't know why.
They're always naked. Yes. Yes. Is that why you went into EMT?
After I left the ER, I went to work pre-op at an endoscopy center, hoping for less of the craziness. Pre-op, just pre-operation. Endoscopy is when they stick a tube in your body with a camera to check what's going on in there. One of the most popular ones, colonoscopy. They'll stick a camera tube up your butt and make sure you're all good and functioning. On Fridays, the local prison would bring in inmates for procedures. One of my shackled patients was being extra friendly this particular Friday. About a week later, the manager informed me that I received some mail. Turned out to be a 10-page letter from said inmate where he alternated between professing his love for me and his desire to kill me. That turned dark real fast. The warden immediately came, confiscated the letter, and he had time tacked to his already very lengthy sentence for murdering his girlfriend. How sweet! To whom it may concern, I love you. And I also want to kill you. His love languages are words of affirmation and acts of murder. Can you imagine the prisons on a Friday? Prison guards, it's Friday! Prisoners, yay, Friday! Colonoscopies! Woo-hoo! I think that's probably why he fell in love with his nurse. I mean, you stick something up a guy's ass, how do you expect him not to fall in love with you? It's your fault. This poor guy. Already lengthy sentence for murdering his girlfriend. I guess old habits die hard, and so do his exes. So you tested positive for an STI. We're gonna send you home with some antibiotics. Yeah, about that. Oh, quick question. Can you give me a little extra? It's standard to just take 1 round of antibiotics for chlamydia, sir. Oh, it's not for me. It's for my girlfriend. Oh, sir, if you've been sexually active with her, she should come get tested too. The thing is, I don't want her to know she has it. Why? Because then she'll know I gave it to her, and then she'll know I got it from someone else. Well, I think that's a conversation you're gonna have to have with her. Can I just pay double? What? No, sir! How are you gonna give her antibiotics without her knowing it's antibiotics? I don't know, I'll tell her it's a new vitamin or something. Absolutely not! Then I'll crush it up and put it in her breakfast cereal. Whatever, man, come on, just help me out. Sir, what you are describing is illegal. You're such a jerk, man. My wife is at home slaving away with our newborn baby, and you would rather add more stress onto her plate than just let me drug her without consent? I'm the jerk in this scenario? Fine. Just go splitsies with my wife with what I get. And you know what? I'll save a pill for the little guy, in case he catches it breastfeeding or something. Once again, not only is that illegal, but it won't cure you if you don't take the full course. And when she finds out, which she will, she's gonna kill you. She's not gonna find out. Sir, she just had your baby. She's running on no sleep, pure hormones, and spite. She's gonna be mad at you regardless. But if you lie and try to drug her, she's definitely gonna kill you. Ugh. Fine, I'll tell her when I get home. And who knows, maybe she'll forgive me. And we can start a family with a clean slate. Yeah, you never know until you try. Hello, sir, my name is Ben. Oh my god, you were right. She was mad. Oh. I said 18 gauge, more like you need to increase my wage. I have a question for you. Oh. What's up, boss? Can you remind me what your nursing license number is? What? Your nursing license number. The one we have in our system is wrong. Oh, no, it definitely should be right. That's odd, because according to the Florida Board of Nursing, your ID belongs to a woman. I see. You know, I knew one day the truth would come out. You see, I was born. Your ID belongs to an Aliyah Adebayo. A woman in Africa? Right. So do you have any paperwork? Duh. Yeah, I'm just kidding. You know, my license number is 1, 2, 3. Your license number is 1, 2, 3. Do you even know how many numbers are in a Florida nursing license? 6, 7? Okay, look, I think we're focusing on the wrong thing here, which is that for nearly 2 years, I have cared for more than 4,000 patients without a license to practice. Perhaps, but as a nurse without a license, but with love. Any different than a nurse without love, but with a license? Hi, can you send the cops up to 3 West? We have a criminal up here. This is discrimination! This is discrimination! He's in the hallway.
This morning, a Florida woman is behind bars, accused of treating thousands of hospital patients without a license to do so. Police say 29-year-old Autumn Bardiza, seen here on body cam, was arrested in Palm Coast, Florida for posing as a licensed nurse for nearly 2 years. During that time, providing care to almost 4,500 patients.
No! MedSurge, this is... Hello, MedSurge. Hello, ER. I'm calling to give you a report. You know, we usually don't take a report after 6:35. Do you mind waiting to the next shift? Oh, well, I didn't realize that after 6:35, you no longer had to do your job. That's not what I said. And also, it's only 6:34. Bed management literally just booked the room, and I am calling to give you a report. I have a patient going to room 303, bed 1. Oh, well, the patient in room 303, bed 2 is actually a screamer. Bed management should have blocked that room. My patient is deaf. Yeah, my patient is confused and strips at all times of the day. My patient is also blind. Can I get their medical record number? Why? I'd like to make sure the patient's orders are put in correctly. The resident is putting in orders now. Oh, so you're telling me you're sending me a patient with incomplete orders. Medical record number 40000516978. I see the patient's last vitals were taken at 5:15. That's correct, and they're stable. And they may not be anymore. I'm gonna need a repeat set of vitals before they come up. Done. It also says the patient has a history of bradycardia. That's their baseline. But in triage, it says dizziness. That's been resolved. Have they seen a cardiologist? Yes, they have been cleared for your unit. Do they have a diet order? Like I said, the resident is putting in the orders now. Dinner trays are being brought up right now. If this patient doesn't eat, they're gonna be starving all night. I will make sure they come up with a dinner tray. They're diabetic. I'll recheck their blood sugar. Fine. Give me a report. Like I said, help! Room 303, bed 2's Foley's leaking all over the floor! I'm so sorry, ER. Bed 2 just had an accident and we're gonna have to call EVS to clean it up. So, why don't you go find a bed elsewhere in the meantime? I'll get you next time, MedSurge. Can you please come help me? Oh, yes, coming. Congratulations on your new baby boy. Here's the birth certificate. Just put his name, your signature, and the date down below.
He's perfect. We're gonna name him Cass.
That's an adorable name.
Casanova. He's a ladies' man if I ever saw one.
Casanova? He's not a 16th century French nobleman. We're gonna name him after my hero, Donatello.
Oh, like the Italian sculptor?
No, the Teenage Mutant Ninja Turtle.
I told you, if we were gonna name him after a turtle, it was gonna be after Michelangelo.
Oh boy.
Michelangelo is lame!
Like father, like son.
Why don't I just leave the certificate here for you guys?
No. You're gonna help us settle this once and for all. Which name do you like?
Okay. Why don't we split the difference? Casanova Donatello.
Are you trying to ruin my baby's life?
What the hell kind of name is that? Are you trying to get my son bullied before preschool?
Preschool? Our son will be homeschooled like a proper Casanova.
Nurse, hold the baby. My wife and I are gonna knuckle this out.
No, let's not knuckle this out in the hospital or anywhere else for that matter.
Wait a second. Knuckles.
You know what? Knuckles does have a beautiful ring to it.
Congratulations on your new baby boy. Knuckles Casanova Donatello Lee.
তুমি পড়ো ঘুমাও তাহলে গুড নাইট আর বাই
সহজে কোনো কিছু পাওয়ার মজা নাই কিন্তু আমগো দোষ জিসান কি কম
ও
ভাবি লাগে বেটা লজ্জা লাগে না কি ওর কথা বাদ দে পারো তুই যা
জামুই তো তুই চুপ থাক
আমি তো আপনাকে চিনি না
চিনো না যে আজকে চিনলা আরো চিনবা আস্তে আস্তে চিনবা আর শুনো আরে বেন সাহেব নতুন নতুন সম্বন্ধ তো তাই চিনতে পারেন নাই ওই যে আপনার বান্ধবী তুলি আছে না
আমার তাহলে বিশাল বিপদ আমি তাহলে কোচিং এ কেমনে যাব পড়াশোনা কিভাবে করব আমার তো ভয় লাগতেছে
কি খবর
আসসালামু আলাইকুম
ওয়ালাইকুম আসসালাম কি খবর 3 2 1 আর আজকের রাত 10টা হ্যাঁ রক্তজ্ঞান ইতিহাস লিখবো ভালোবাসার ইতিহাস
ভালো আছি আপনি ভালো আছেন
আমি তো ভালো আছি তো তোমার বোন কোথায়
আচ্ছা একটা মিনিট আমি কল দিচ্ছি এক রাতে ভালো হয়ে গেল এটাও আমার বিশ্বাস করতে হবে? দোস্ত আমার না ভয় লাগছে।
কি করবি? চেনা চেহারা না হলো কি চেহারা, কথা তো বেশি চেহারা ওরকম বেশি।
আপনি না শুনি না দেখা সব জানা ফেলছেন বাবা।
এটা সত্যি সত্যি প্র্যাঙ্ক ছিল, আমি ক্ষমা চাচ্ছি, সত্যি সত্যি প্র্যাঙ্ক ছিল। এ ভাই দেখেন দেখেন দেখেন,
সুইট সুইট রেডি এসে সুন্দরী মেয়ে আসতেছে। সুন্দরী মেয়ের ভয় দেখানোর মজাই অন্যরকম। 20 মিনিট দেরি হয়েছে। হ্যাঁ মানে আই এম রিয়েলি সরি। আর কখনো এরকম হয় না, এত জ্যাম ছিল। জাস্ট 20 মিনিট লেট হয়েছে আর কখনো না। আই এম রিয়েলি সরি, অনেক জ্যাম ছিল।
সরি মানে হু আর ইউ?
ও মাই গড, আইফোন 13 প্রো ম্যাক্স। মাল্টু আছে তাইলে দেখি, মাল্টু বের করুন। এই ব্যাগ দেন। দেখুন ওদিন প্র্যাঙ্ক করছি, ভালো লাগে না তাই না? হ্যাঁ
ও তো ইউটিউবার, এই যে কি সব অদ্ভুত প্র্যাঙ্ক করে বেড়ায় মানুষের সাথে। কেন কি হয়েছে বলতো? হঠাৎ ওর কথা জিজ্ঞেস করতেছিস?
কি হয়েছে? আমি ওকে খুন করে ফেলবো। আই শুড পানিশ হিম। আমি কিছু না, প্র্যাঙ্কই সব কিছু। ওই প্র্যাঙ্ককে তো আমি ধ্বংস করেই ছাড়বো, বুঝলি?
আরে মাথা এত গরম করিস না।
আমার নেক্সট আপকামিং 5টা প্রজেক্টের ফুটেজ ছিল এই ফোনটাতে। তোমরা এটা কেন করছো এই ফোনটার মধ্যে? ফোনটার মধ্যে আমার কত জরুরি জরুরি ফুটেজ ছিল। আমার
শোন,
হোয়াট দ্য ফাক? এই আপনি কে কে এসব কি করছেন আপনি? দেখতে মানুষের মতো আর ভূতের মাস্ক পরে ভয় দেখানো। হ্যাঁ আমি কখনো তাকে দেখিনি, চিনিও না ইভেন। এই কে আপনি? হোয়াট দ্য হেল? আপনি জান
হু আর ইউ? হু আর ইউ? ওয়েট বলছি একটা সেকেন্ড। শোরের উপর বাটপারি রে।
তো আসল শাস্তি হয়েছে, চলো বাই। আমি কিছু না, প্র্যাঙ্কই সব কিছু। ওই প্র্যাঙ্ককে তো আমি ধ্বংস করেই ছাড়বো, বুঝলি?
আরে মাথা এত গরম করিস না।
একদম পারফেক্ট, এটাই তো চেয়েছিলাম। ম্যাক্স আর ম্যাক্সের মা তো অজ্ঞান হয়ে যাবে। আপনি এত সুন্দর আপু, আপনাকে দেখে তো ওরা সবাই খুশি হয়ে যাবে, সেটা আমি চাই।
মনে নেই একবার টাকা দেওয়া নিয়ে কি নাটকটা করলি?
আচ্ছা ঠিক আছে, আমাকে বল টাকা দিয়ে কি করবি, আমি দিব।
বাবা মেয়ে মিলে আমার থেকে কি লুকাচ্ছ তোমরা? হ্যাঁ দেখো আমাকে।
এখন মনে হয় 30 টাকার মতো আছে, নিবি? 30 টাকা দিয়ে কি হবে?
কয়েকদিন ধরে দেখতেছি তোর পড়াশোনায় একদম মন নাই। দাঁড়া তোর আব্বারে বলতেছি।
যাও যে এখন
আমার মনে হয় আমি জানি স্পেশাল মানুষটা কে। আরে রূপা না, আছে অন্য কেউ।
তোমাকে কিন্তু আমার অনেক ভাল লাগে আপু, কিন্তু তোমার ভাইটা না কেমন জানি। তোমরা দুই ভাই বোন, নিজের ভাই বোন, কিন্তু দুজনের না কোনো মিলই নাই। কই সবাই তো বলে মিল আছে। দাদা বাড়িতে ঈদ না করলে মজা হয় বলেন?
এখানে অনেক মজা হবে।
দাদা বাড়িতে
ভাই আপনি নিয়ে আসেন, আমি আপনার 500 টাকায় দিব, ঠিক আছে? ঠিক আছে তো? হ্যাঁ ঠিক আছে, তাহলে নিয়ে আসবো না কিন্তু। ঠিক আছে ভাই।
তুমি দুনিয়ার কিনা তাই তো আমার সন্দেহ। মনে হচ্ছে বেহেস্ত থেকে হুড় করে নেমে আসছে।
কিন্তু হাসতেছো কেন?
না আমি আর্জেন্টিনা, আর আর্জেন্টিনা এবার বিশ্বকাপ নেবে।
কি কথা বলবি? এমনি ফ্রেন্ডশিপ করবো। তোর কাটা কেমন?
ভালো। টাইম নিবি?
কারের দোকান আসছে তো কাঠ কেনার জন্য।
মা, মোম দিয়ে যাও না। আরে আসতেছি রে বাবা। আপনি ব্রাজিলের সাপোর্টার, আর ব্রাজিলের সাপোর্টাররা কেমন হয় এটা আমি জানি না। ওরা কখন আর্জেন্টিনার ভালো